Hey guys, this is Vicky. I just want to take a little bit of time and we'll go through some of the components at least to research. This is not an all-inclusive list, but it will give you a general idea about nursing research. So why nursing research? We know that the ANA Standard 7 does focus on research and that the nurse uses research findings in practice. We also know that according to the NINR, nursing research develops knowledge as related to building the scientific foundation for clinical practice, preventing disease and disability, managing and eliminating symptoms caused by illness, and also enhancing life um, enhancing end-of-life and palliative care. So we know that through research, we not only develop knowledge, but we develop evidence-based practice by which we can provide effective care that's improving the quality of care that we deliver. We know that there are 7 steps to evidence-based practice. The first is precise definition of a patient problem. The second is IDing the necessary information to solve the problem. The third is a literature review or search. The fourth is critical appraisal of the evidence. So does it apply to us? Can we use the information that we're considering, we're researching, we're reviewing, can we actually use it in practice? Can we extract an answer as it applies to the patient? 2, can we determine if a change is necessary? Protocol development and clinical guideline development. Can we change protocols or can we develop new protocols to support the evidence-based practice? And lastly, can we evaluate the effectiveness of the potential change that we want to make? So when we think about research, we think of both qualitative and quantitative research. These are really the 2 types of nursing research that are used. Qualitative research is really organizing and interpreting data of non-numeric form, so non-numbers, not something we can quantify, for the purpose of discovering an underlying dimension or patterns of relationship. So it's thinking more of quality, so it's focusing on discovery rather than verification. Oftentimes it will focus on feelings and or experience, and interviewing is really one of the main techniques to do this. So an example of potentially a qualitative research would be, what is the nature of coping and adjustment after a radical prostatectomy? So it's looking at quality, it's looking at feelings, it's looking at experience, and most of this information, like I said, will come from interviewing multiple patients who've had radical prostatectomies. On the other hand, quantitative research is really the manipulation of numerical data, so numbers, through statistical procedures for the purpose of describing a phenomena or assessing the magnitude and reliability of a relationship. So in short, it focuses on how many and or how much. So a quantitative research study could potentially be, are there differences in skin breakdown with premature infants bathed in plain water versus bacteriostatic soap? So it's going to compare and look at the numbers of premature babies that are bathed in water versus the soap and really pull out the data from the numbers. Oh, my little clicker is just not working today very well. So the steps in the research process. The first step is really to state the research problem as a question. We want to narrow a broad area of interest to a problem that specifies the exact intent of the study. So it could be a problem in practice that you're seeing. It could be a contraindication. It could really be anything of significance, or could it be an area where there's minimal research that has been done? It's an area in which you see a problem, you see there's not a lot of research to support it, or you just want to see if something can be done better by doing different interventions or procedures. So when we think of criteria and what criteria should be included, first off we want to have the significance to nursing. So does what you're trying to research contribute to patient care or resolve or improve a current problem? If it does, great. Then I think it's definitely worthwhile moving forward with the research plan. However, if your question or your answer to that is it's not really contributing, resolving, or helping improve patient care, then I don't even know if that's worth going down. Researchability. Would this be realistic? Can it produce the generalized information that can be researched and the data be used to further advance nursing, the nursing field? Is it feasible? Would you have the available time, resources, potentially money, people to perform the study, people to be in the study? Research can be very lengthy and also be very costly and very time consuming. So being able to understand if the research is feasible is very important early on. So non-researchable questions. So for the most part, when you define a research problem, it cannot be a yes or no question. So example of not a good question: do dying children have spiritual needs? That is not a good proposed research project. Maybe a better question for that same situation is, what type of spiritual needs do dying children have? That way it's more open-ended, and the research trial or trying to find a better understanding to it would be more open and broad, and not just the yes or no. Another one that it should not be is that the research questions cannot be answered with should, would, or shouldn't be started with should, would, could, or value question. So a poor example of this would be, should all diabetics learn to give insulin? Instead, a better question would be, what type of education do diabetics need for effective health management? You can see how by changing the research question, it will allow for more data and more information and more growth in that area. And then the last is ask what is or what are. So what is the main factor, or what are the stages of grieving? Things like that would be good research questions. So the second step when we think about nursing research is to define the study's purpose. So the first, can it be studied? Is it researchable? Is it a problem? I mean, we already talked about some of this. Is it significant? Why is it important? What will you do? Is it feasible? Who? So who's going to be studied? Who's going to do the studying? And lastly, where will data be collected? So let's take a look at a research example. So here's our question. The purpose of this study is to discover the thoughts, feelings, and attitudes of newly divorced men living apart from their children. So we'll use this study throughout this presentation to help you understand how to use the research a little bit better. So now that we've come up with a research question, our third step is to do a literature review. So your review has to be comprehensive and include early research to current research. It needs to provide a foundation to base your knowledge, show gaps, and supports the need for your idea. What you should do is do some narrowing before you actually go to the library. Think about key terms. Be prepared to narrow or expand your search depending on what you find. Plan to spend time in the library, but don't waste time getting a librarian to assist you if needed. There are many great nursing databases. Oh, all of a sudden, I'm having a moment. Oh, shoot. Err. Sorry about that. Okay, so plan on spending time in the library. Sorry if this is a repeat. But the idea is that you want to go to nursing databases such as web. Why am I having an issue with this? EBSCOhost is a good one. CINAHL is a good nursing database. If you plan on going on for your bachelor's degree, I assure you that you will spend a lot of time within nursing databases to find evidence-based practice support to support the many papers that you will be writing. But take a look in there, especially for this midterm research project. I do want you to grab evidence-based practice, literature reviews, and research journals. Okay? And then begin by identifying major professional nursing journals, like I just said, and start there. If your problem is in a specialty area, you may want to start in a specialty journal. However, for the most part, you should be able to pull out the major concepts of what you want to research and then put that in the database, and they should be able to pull out the articles that you may potentially want to take data from. If you find one article related to the problem, look at the author's reference list, because listings of other articles are great. You can actually take the journal article and use some of the references that they also referred to in their article to gather greater information about the current problem and maybe what research has already been done. And then look at the table of contents in the journal where you found the one related article, because this sometimes can also help. And then also primary sources are the persons that actually conduct the research. So by taking a look at that information and seeing, many times researchers will do research on similar research projects, so you may be able to find more information just by also looking at the person. So in your literature review, link to previous research we talked about. Has it been studied before? What is known? What is not known? The primary sources, meaning the research articles, and then prior methods that were currently used are important. So when we think back to our research that we had talked about in here, these may be topics that you'd want to research in regarding the thoughts, feelings, and attitudes of newly divorced men living apart from their children. So you may want to research in the database divorce, maybe child support or father-child relationships, life adjustment, marriage, custody. You know, these are all just examples of key terms that could help drive the research that you need to find to be able to create your research for this question. Okay, so when we think about our fourth step in the nursing process or research project, it's really to define the variables and formulate a hypothesis. Variables are the concepts, and they vary or change in value, much like our weight, blood pressure, anxiety, temperature, feelings, etc. A variable is any quality of a person, group, or situation that takes on different values. So when we think of a dependent variable, these are typically behaviors, characteristics, or an outcome that a researcher wishes to understand, explain, or predict. However, an independent variable is usually the presumed cause or influence on a dependent variable. So variables do need to be measured, and they are often used within the nursing research process. The hypothesis, on the other hand, is a prediction of the expected outcomes. So usually it is a statement of the expected relationship between the dependent and the independent variable. It's typically worded in a simple, clear, and concise language, and it provides a definition of the variables in concrete and also in operational forms. So if we take a look at a different example, let's look at this just for a second. So is abuse during childhood related to women's victimization throughout adulthood? So if we were coming up with a dependent variable, remember dependent variables are behaviors, characteristics, or outcomes that researchers wish to understand. Our dependent variable here would be childhood abuse, okay? Our independent variable, or the presumed cause or influence would be on the dependent variable, would be the women's victimization. Because if children were not abused, what we're trying to say is if children were not abused, then they would not be victimized in adulthood. So that's why the women's victimization would be the independent variable. Okay? Go lay down. Here's another example. So what is the effect of regular active exercise during the last trimester of pregnancy on maternal weight gain and infant birth weight? So the dependent variable could be the maternal weight gain and infant birth weight, where the independent variable would be the amount of exercise. Okay. Now if we go back to our example, our research example, our dependent remember this was on our man who just got divorced along with his children and his feelings. So our dependent variable are the thoughts, feelings, and attitudes, whereas the independent variables would be the father living apart from his children. So our hypothesis in this research study would be that fathers that are newly divorced will experience deep grief, frustration, anger, pain, and a sense of loss when living apart from their children. So it is that easy to set up your research. Now our fifth research process is really to select a research design or a methodology, and that's to test the hypothesis and answer any questions. So there are three types of research design. The first is the experimental, in which the independent variable is manipulated by administering experimental treatment to some while withholding from others. So if we give a really easy example, let's say that we're working in a nursing home and we want to study the effects of prune juice. So with an experimental trial, we would divide the nursing home patients into two groups. One group would get the 8-ounce prune juice, 8 ounces of prune juice per day, while the other group receives just their regular diet. And from this, we would be able to take the research and see which has improved elimination patterns. So that would be the experimental type of research design. The quasi-experimental is in which the independent variable is manipulated, but subjects are not randomized. It's kind of in a convenience sample. So in that same example of the nursing home, it would just mean that the prune juice is given to all residents who have elimination issues. And then from that, they will take the data. And then lastly, the non-experimental would be that data is collected without manipulating the independent variable or controlling subjects. So in that same situation with the nursing home, data is collected regardless of the elimination patterns of all residents, including the current use of prune juice versus regular diet. So it would look at all of the patients. So the fifth step is really to define which research design or methodology you want to use, what would be in the best interest of your research question, which would support or be able to gather the correct amount of information to be able to move the evidence base forward. Now our sixth step is to select the population, sample, and setting. So the population is really defined as all possible members who meet the criteria for your study. So whatever you've set your criteria to be, your methodology to be, you're going to select the members who meet the criteria for your study. The sample is the subjects from whom the data will be collected. So other things to consider is how will you obtain subjects? Are you going to do a random sample in which you just choose certain ones who meet your criteria? Will you do a sign up? Will there be an advertisement? Will it be in a healthcare setting? So there's many ways to obtain subjects, and then how will you safeguard their rights? And we're going to talk about them here in just a minute. So sampling considerations, when we think about a random sample is a selection using random principles. So let's just take, for example, you wanted to do a study on obesity. You take all names in the phone book, and maybe every 10th name would be your sample. So it's very random. You're just kind of taking the population, or and going with it. So a lot of times that this is done, and computer programs can actually assist with this process, but it's very random on who's selected within your study. A non-random sample is your convenience sample, much like that quasi-experimental example with the elderly in the with the bowels problem. And then generalized is the degree in which the research findings can be generalized from the sample to the entire population. So what you should ask yourself is, would the research on this yield what would be or could it be generalized to all? So if you were measuring patient satisfaction in a hospital, your sample would need to represent the entire hospital population, including the young, old, middle-aged, chronic patients, and acute patients, to be able to generalize and ensure that you're meeting everybody within that population who is within the hospital, to tell you if patient satisfaction is being met or not met. So when we look back at our research example, our population that we would be looking at would be men newly divorced within 1 year, and our sample would be men within Wisconsin that voluntarily signed up for this research study at the clerk of court's office. So a very non-random type of research trial. Now, when we think about protecting those that are in the research trial, a couple of things that we need to ensure is that, one, they have all people who are signed up have the right to not be harmed. Physically, emotional, legal, financial, or social. They have the right to full disclosure and also the right of self-determination, meaning that at any point in time, if they would choose to get out of the research trial, they are able to get out of the research trial. If it's a 5-year research trial and they make it to 4 years, 11 months, they have the right to leave the research trial at any point in time. The other things that we want to make sure that we ensure is the right to privacy and confidentiality. So oftentimes researchers will, and I can never say this word, but anonymity, sorry, but most of the times names are not included in reports. They'll often use code names or numbers or ID numbers for the subjects, so that their confidentiality is maintained, so that they don't have any future concerns or repercussions from the experiment that they were in. All right, and then our 7th step within the research project is to actually conduct a pilot study. So a pilot study is a trial run, typically on a smaller sample, to test the plan. Its goal is really to assess the problems and also the feasibility. It's also to assess the validity and reliability of the instruments and tools that you've defined to use within your research trial. So validity is really the extent to which a concept or your research is measured or well-founded and corresponds accurately to the real world. So I'm having issues today, but the validity of a measurement tool is considered to be the degree to which the tool measures what it claims to measure. Okay, so what you've defined is going to measure what you're going to research and measure, that the experiment is actually valid and that it's measuring what you say it's going to measure. And then reliability, on the other hand, is the overall consistency of a measure. So a measure is said to have a high reliability if it produces similar results under consistent conditions. So example, a real simple example, if a thermometer is to read correctly, to measure refrigerator temperature, if placed in many different times, it would still come out with the same number. That would be a high reliability. Okay. If all of a sudden it's all over the place, the reliability of the research trial would go down. So in order for it to be considered a pretty concrete or reliable experimental research process, you really want a high validity and a high reliability for both of these datas. And then our eighth step is really to collect data, whether that's going to be in questionnaires, scales, interviews, observations, whatever you identify the tools you will use to collect the data is going to be your eighth step. And then the last, or the ninth step, not quite the last, but the ninth step is really to analyze the data. So whether it's descriptive data or the other data that's listed there, it's important that one is able to take from the results and be able to determine if the data is in fact meaningful. So descriptive statistics, procedures that really summarize large volumes of data and shows patterns or trends. So when we think of mean, that's usually the average, the median is the middle, and the mode is the number occurring most often. They're often measured that way. They're often also measured with standard deviation, in which the scores deviate from the mean. And that's really all. You can look up more of this on your own, but I'm not going to speak any more to it. It gets a little confusing. So when we look at our research example, let's say that the data analysis revealed descriptive analysis. The measures of the central tendency will be used to highlight the most common feelings, reactions of these men, and the most common findings will be presented using percentages. So that's how we will report out the data that we find from our divorced man study. And then our last step in our research process is really recommendations. So once the entire nursing research process is over, you need to determine, are you going to make any recommendations for the future, or do you need to maybe rework the research process and fine tweak it and maybe redo some things, or maybe you define that you don't want to recommend what you've did. Maybe things went wrong. So information should either be used or not used. And if it is going to be used, most times the studies could be replicated to ensure that the information is correct. But our last step really is recommendations for future research, or by implementing those processes or not that you've identified. All right, that is all we have for research. If you have any questions, please let me know.